Welcome to our video presentation on Introduction to Health Assessment. Today, we'll be exploring the fundamentals of health assessment within the context of the nursing process.
Health assessment in nursing involves gathering, analyzing, and documenting data of patient health status. It involves collecting patient medical history, performing physical examination, and assessing patient well-being. Health assessment is important for early detection of health issues, individualizing care, monitoring health progress, and educating patient. It promotes patient well-being and improves health outcomes.
First, let's familiarize ourselves with the nursing process, often abbreviated as ADPI, which stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation.
The journey begins with the assessment phase. This is where the nurse gathers comprehensive information about the patient's health status, including their physical, psychological, social, and spiritual dimensions. During the assessment phase, various types of assessments may be performed, depending on the patient's needs and clinical situation.
This assessment includes first, initial assessment. This is the first encounter with the patient and involves gathering baseline data to establish a comprehensive patient profile. Ongoing assessment. This occurs continuously throughout the patient care journey to monitor changes in their health status and to identify any new problems or concern. Focus or problem-oriented assessment. This is a targeted assessment that focuses on specific health issue or concern identified during the initial or ongoing assessment. Emergency assessment. This is conducted in an urgent situations to quickly gather critical information necessary for immediate interventions.
Each type of assessment serves a unique purpose in providing holistic care and informing subsequent steps in the nursing process.
After completing the assessment, the nurse enters the diagnosis phase. Here, the nurse analyzes the gathered data to identify any health problem, needs, or risks. During this phase, the nurse utilizes critical thinking skills to interpret the assessment data and formulate nursing diagnosis. Nursing diagnosis are clinical judgment about the patient's response to actual or potential health problems. They guide the development of the care plan and help prioritize intervention. It's important to involve the patient in this process to ensure the concerns and the priorities are addressed. Patients' inputs enhance the accuracy and the relevance of the nursing diagnosis.
After figuring out what's wrong with the patient, the nurse will start planning what to do next. This is when they set goals for the patient's care based on guidelines. These goals are important for making sure the patient gets better. During the planning stage, we set goals for the patient to achieve in the short term like hours or days and long term like weeks or months. Planning with nursing and ADPI is important because it helps ensure the patient gets the best care possible. This helps them provide personalized care and improve the patient's outcome.
Now comes the implementation phase. This is where we put our plan into action by carrying out the intervention outlined in the nursing care plan. It is essential to communicate effectively with the patient, provide education, and advocate for their needs throughout this process. The step that involves action or doing and the actual carrying out of nursing interventions outlined in the plan of care. Examples are bedside care and assistance, administration of medication, postpartum support, feeding assistance, and monitoring of vitals and recovery progress. Under the implementation phase, we have nursing intervention categories. Independent. A nurse can perform independent interventions on their own without assistance from other medical professionals. The example is taking vital signs. So we move on to the dependent. Dependent, this nursing intervention requires an order from a physician, such as ordering the prescription for a new medication.
We need to see that there is a change in the patient. Either he gets better or the pain he feels is reduced, so that we know if we will repeat or change our interventions with him or if he can go home. Last but not least, we have evaluation. This final step involves assessing the effectiveness of the interventions we've implemented and determining whether our goals have been met. If necessary, we adjust the plan of care accordingly to ensure the best possible outcomes for our patients.
Okay. Meron ka po ba bang nararamdaman na sakit?
Wala na po.
Okay. Mr. Madrid, make sure po na yung disease papers ay maayos na.
Okay. Okay. Thank you, Doc. Okay po.
Sige po.
Sige po, ma'am. Ano po kayo, ma'am? Wala pong nararamdaman.
Thank you so much for joining us in this journey through the introduction of health assessment. Stay tuned for more insights into the nursing process and patient-centered care.